Hi and welcome to Synapse. This is Dr. Sonika. Welcome to the third video of the Mrcs series. Today we're going to be talking about the Mrcs Part B examination. So congratulations for those who have cleared Part A exam and who are here to plan and prepare for the Part B. Kudos, good job. And those who are new here, I'm Dr. Sonika. I'm a senior resident and a trainee in plastic and reconstructive surgery in India, and I have cleared my MRCS exam in the year 2023. So this video series is just sharing my experience and helping those medicos who are appearing for the exam and to help them with the tips and tricks that really helped me during my journey. Now let us look at the marks distribution of the various stations. Knowledge stations, we know that we have anatomy and pathology, and then we have the surgically applied knowledge and critical care. Now, if you look at this anatomy, okay, I'm going to point with my cursor here. So for anatomy station, so the total number of marks is 20, okay, and it is purely on your knowledge, okay. So whatever question they ask, you answer and you get it right, you get marks. So you have anatomy one, two, three stations, pathology also same, and critical care also same. So here there is no marks given to your communication, your professionalism, nothing doing, okay, clinical skills, nothing. So now coming to your critical care. So when you come to your critical care, it is 12 marks for your knowledge, okay, as in whatever you're going to answer regarding, okay, let's say this is they're going to show you an X-ray or CT, and then you have to arrive at the diagnosis, what do you think the problem is. So basically all that clinical knowledge they're going to ask. So you get 12 marks for that. And then for clinical and technical skill, okay, you get 4 marks. And you get 4 marks for professionalism, which includes like decision making, problem solving conditions, and situational awareness, and judgment and organization and planning regarding patient safety. Okay, so they can ask you about, okay, what is the how are you going to manage the patient? You've done A, B, C, D, E. How are you going to manage? If at all it requires an MDT involvement, let's say patient also has head injury associated, uh, chest injury, pneumothorax. So you will say, okay, I'm going to use MDT, and the patient will require an urgent ICD insertion. Basically, it is prioritizing and being aware of the situation, and you're going to tell as to what you're going to do first, okay, for the patient. So all of those things is going to carry another 4 marks. And in that clinical technical skills, okay, I just mentioned all that, saying hi, bye, introducing yourself, being empathetic, and all those things is going to again carry marks. Okay, so that's regarding your knowledge stations. And if you look at the skill station, okay, we have the communication as well as the procedural skills in broad division. So in communication, here we just said that you're going to have, see, if you see the marks distribution for communication, there's only 4 marks for your knowledge, okay. For example, again we can talk about the spleen itself, the spleen station that I got, splenectomy wala. So wherein you're getting 4 marks only to see how what is your accurateness of the information that you're providing, let's say regarding vaccination or regarding the procedure itself. And one more thing I forgot to tell you during the communication station is, do not use scientific terms. Always use layman terms. Okay. So when you say, okay, we have done splenectomy, don't directly say, okay, we have done splenectomy of your child. Okay, you need to explain that spleen is an organ that is present in the left side of the tummy, and that is an organ that is going to, kind of filter the blood, and that is the one which is necessary for providing immunity against certain organisms. And in your child, this is the organ which has undergone injury, when probably the child, when she he or he fell off the slide or fell off whatever the thing is in the park. Okay, so it depends on whatever is given in your uh, question stem. So those are the things that you have to keep in mind during communication. So again, coming back to the table, so you get 4 marks for your knowledge, but you see you have 12 marks with communication. Okay, so which will include again being empathetic, explaining to the patient in layman terms so that in a way that they understand, and having answered all their questions in clear and understandable language. Okay, and being understanding. Okay, so these are all the things that they're going to consider and give marks here. Okay, 12 marks is for that, and 4 marks is for professionalism, again, decision making, and taking, organizing, and basically planning the patient's further care. And same applies to communication with, this is your phone call station, okay, where you have 8 marks for talking to the consultant, okay, and you have 8 marks for again, as I said, decision making. The consultant is going to ask you, what do you think the problem is, okay, what is the value of this, let's say creatinine, what is the creatinine value, okay, appears normal, what do you think is the IO chart of the patient, okay, you see that, okay, input is low, then you'll be like, okay, what do you think has happened? So then you think, okay, the here the input is less, so it is called hypovolemia. So you come up with the you're the one who's doing the problem solving, you're going to kind of make a plan for the patient. So that is why in phone call station you have 8 marks for the professionalism part. And the history taking, again, only 4 marks for your knowledge, but majority of that is for your clinical skills, okay, and your communication as well as your professionalism. So again, so the distribution remains same for history, and examination part, okay, remains the same. And coming to the procedural part, procedural skills, like I said, catheterization, all that, okay, you get only 4 marks for your knowledge. Everything else is, rest of it is regarding your clinical skill, how you perform the skill, as well as your communication, and okay, and your professionalism. So that's all that matters. So you see the distribution of marks in like in this part versus this part. Okay, so that is what is important. So when the procedural skill involves a patient, like let's say doing an excision or catheterization, basically there'll be a mannequin, but still it involves doing some procedure on a patient. Okay, so those things will test you on your communication part and your professionalism part. So other things like, time not wherein it is just going to be a device in which you're going to do, and or again, as I said, making your OT list, okay, prioritizing the patient. So they'll give you 4 5 patients, okay, with certain diagnosis, and they'll ask you, okay, if you have to make an OT list for an OT tomorrow, so in what order are you going to put this patient? So initially you will put, okay, diabetic patients first, because obviously, you cannot keep them NPO, they're prone for hypoglycemia. I'm going to put that first. And kids are going to be given first priority. Patients who are seropositive will be coming last. Patients with MRSA are again going to be posted last. So you have patients with certain diagnosis they're going to give, and they're going to ask you in what order are you going to place them in the OT list. So stations like that. So these are all the technical stations where you do not interact with patients, so there's no communication professional. Here you get only marks for your knowledge as well as your skill. So this is something that I want you guys to have in mind while preparing for the exam. Look at the marks distribution, and put energy towards certain aspects that you can see here. So in a station, when it is carrying less marks for knowledge, so do not crack your head reading everything about it. So instead, think and practice more in terms of communicating with the patient and trying to be more professional in your approach. Okay, so these are the things that you got to keep in mind while preparing for each and every station. So keep this picture in your uh, preparatory toolkit, or it could be a book, or it could be on your phone. This is extremely important. Okay, so now let's discuss about the study materials for the Mrcs Part B exam. So as I've already mentioned in the video, I will give the link or the material itself in the description box below. So what I did was I took a printout of these whatever materials I got, and I spiral bound them, made a book, and I just used this material, went through all the scenarios, the examination part, the anatomical station part, the pathology part from this. I did not read anything extra for anatomy as such. I just went through a lot of images, cross-section images, and atlas images to just solidify and to gain confidence in my for the anatomy station. Pathology, I just read through the material, that's all. And for skills and examination, I just use the material that I will be posting in the description box. I just read through that. Practice this with a study partner, okay? Or if you don't have anyone, just do it on your parents, your whole catch-all of your sister, brother, whoever it is. Or if you don't find anybody, just go to a ward and do it on any patient. Okay, so that you remember, the order of doing the examination part. So that's all I use. And apart from that free material, okay, there are certain books that you can use actually. This is what I had ordered from Amazon and I got it. It's a pretty good resource I found on the internet. This is called Doctor Exam, Part B OSCE material. So this is the book one, so which covers all the applied surgical science and critical care anatomy and pathology as well as the skill station. Okay, all of that here. So this is what I meant by pro section. Okay, you can see the neck. Okay, you can see this picture here. So that is the kind of images you get. Okay, let's say the neck, or it could be your brain, head and neck. So these are the images on which you're going to identify different structures. Okay, and this will be for your critical care station for the imaging, identifying one. So I kind of found this book pretty useful, the way in which they've given diagrams. Okay, I'm so sorry. Okay, so they are given diagrams, with labelings and tables, and I found this quite useful. I use this adjunct to the material that I will be posting on the description box. This is the part two of that book. Okay, on this has only the examination history taken and the communication part in this book. So it is a two-volume book, so you could kind of order this and use it along with the material that will be provided to solidify your theory aspect, that the basically the reading aspect for part B, and rest of it is how you practice and how you perform your examination and the skill station and everything. So for the practical part, as I said, you have to do a hands-on course. There are many actually. The one I personally used or attended was the Salah course. It happened in Delhi, like 1 week before my exam. So I was doing my exam in Delhi. I was more than happy to just attend it. It was on a weekend, so I did not even have to take leave from my posting or wherever I work. So I just went there and attended. It will be usually a 2 days course, and it was quite helpful and useful. But the best course, if I have to suggest, would be the RCS Edinburgh hands-on course. There's nothing like it. It just costs around £700. So you have to kind of watch out as to when they are having their sessions in India. They have regular sessions in the UK, but in India you've got to kind of watch out for the dates. Before book your slot beforehand, and the examiners who come, or the mentors who come for the hands-on course during the Mrcs Edinburgh basically courses, they are the same examiners who come in your actual exam as well. So you really get the feeling of the examination, okay? And the points that they're going to tell you and highlight are the ones that the examiners are looking for, okay, in a candidate. So it's a very very good course, an eye-opening course, I must say, for all the candidates. And most of the information I've shared here today is somehow acquired from these examiners. So there are very valuable points that I've shared during the course of the video. There might be some that I must have missed out, and if I do remember, I'll definitely mention in the description or make another video, or let's see how that works. But the important crux of it, I have got it out in this video. That's about the materials, and there are some atypical materials that some people use, and they have said that it has been useful for them. I would want to mention two such resources. One is called the MRCS Bootcamp. So that is available. I think it's a website. You just have to search MRCS Bootcamp. So they said they have materials, videos, and also certain mock sessions, live mock sessions that happen. So for people who think they cannot sit and read, or who know themselves very well that they cannot keep the books with them and just go through the books and attend hands-on course and clear it. So these materials are for them, for people who think when someone teaches them, it's they absorb better, or they retain better, or they remember better. So these are the kind of courses for them. And I think Abdullah Mansoor is another person who has a YouTube channel, and he's a professor in UK, and he has you know videos on part B preparation. So you have to kind of subscribe to his channel to get access to those videos. You guys might try these resources. I have not used them you know uh, as a first hand person. It's just that through people who have used it, I've heard that it's good and informative. It kind of helped them. So I'm just putting it out that if you are interested, you could just like have a look, and if it works out for you, it's great. That could be a good study resource for you people. So these are the things that I used, and a preparation period of around 4 to 6 months is sufficient. If you're doing a job, I would say keep 6 months for the preparation. And if you are, sitting at home and preparing for this Part B exam, giving dedicated time and effort, then I would say 4 months should be good enough. So the first thing you should be doing is go through all the materials, go through this, read it, and next you will have to book your hands-on course in the last 20 to 30 days of your exam, so that it helps you revise all the things that you've read and also consolidate your procedural skill part of the exam. And for the examination and the history taking part, there is a free resource on YouTube. Basically, there is a channel called Geeky Medics. I think most of you must have heard. So students use this resource for both lab as well as the MRCS. So you have a large array of videos on history taking and on examination. They're short videos, so it just helps you kind of consolidate in your mind visually as to what exactly you're testing and how are you doing a particular test. Let's say if you're doing the knee examination, you need to know the drawer test, the Latchman test, so how exactly do you perform this. You just see a video and everything becomes clear. 5 to 10 minutes video, you've read theory, now you look at the video and you do that on a let's say your friend or your patient or whoever on whom you're examining, and then you consolidate the whole station. If this comes next, you just know how to go ahead with the station. And during your further practice sessions, you will have to time yourself. So if you're able to do the whole station, the examination, in when let's say first time, it will take longer, it will take 8 minutes, 10 minutes, but you have to do it within 6 minutes. So over time, as you keep preparing, practicing these stations, you will try to kind of fit the practice session, or basically the whole of the examination or history taking, within 6 minutes. So that should be your attempt. Okay, so that is how you prepare for this exam. And as I said, 4 to 6 months should be good enough, and the pass rates are pretty good in Part B exam. And the pass mark for the exam is different. Okay, so it depends on the cohort of students who are appearing for the exam from your examination center. And for those stations who appear for those students who appear uh, only for those stations, as in, see, if the examination is for 3 to 4 days, every day the stations change or the order changes, or let's say the topic changes. If today they have kept upper limb, so tomorrow it might be lower limb. If in lower limb they have kept knee, next day they can keep ankle. So like that, the topics change, the stations change. It's not going to be the same for, let's say, for 3 to 4 days of the exam, right? So on a particular day, let us say it happened on a Friday, let's say 14th, and then the average marks would be for all the students who appeared on 14th, okay, of the month, and at that particular station, examination center, with those stations, okay, that have appeared, or rather tested on that day. So your average is going to be depending on those students only. So it's not an average of all the students who have performed with across the stations. No, it does not happen like that. Okay. So that's how an average will be picked up. And the marking, the knowledge station will be somewhere, I think, around 120 marks. The skill station will come up to 180 marks. So you have to be comfortably scoring about 100 in your knowledge stations put together, and your skill station you should be getting somewhere around 120 plus around 130-ish, so that you are pretty sure of passing in your part B exam. So that's a lot of things that we've discussed today, right? From the pattern of the exam, the syllabus, the different stations, how to approach them, what are the study materials to be used, what are the tips and tricks that you can use to maximize your scoring, and overall, how to approach the exam. Okay, I hope this video has given you confidence and a plan as to how you can, at least start off with your preparation. So if you have any doubts or queries for us, do let me know in the comment section below. I will definitely answer. And one thing I want to highlight is, because I was getting a lot of questions and comments saying, what about the FRCS exam? So FRCS exam is uh, you know now, MRCS has become a mandatory step in order to apply or become eligible for the FRCS exam. So this is something I wanted to highlight. So now FRCS you cannot write directly. Okay, I think it's been 3 to 4 years since the a new rule has come out saying you have to clear MRCS in order to be eligible to write the FRCS exam. Okay, so yeah, that's that, and I have covered all the important points regarding Part B exam, I think, according to my knowledge. So, as I said, if you have any questions, do let me know in the comment section below. And that's it. All the very best for your Part B exam.